And thank you very much for attending the Summer Learning Academy session. I'm going to throw it right over to our colleagues here from CBVRCE to take us through some of the work that they're doing up there in their region. Over to you.
Awesome. Okay, I'll get started. Thank you, Ryan, for that land acknowledgement. I will mention that we've been allotted 1 hour for the presentation, but we are going to keep it shorter, so we likely won't take the hour. And it's important to note there are lots of roles on the school teams, as we will discuss today. And so Alice and I will do some introductions in a moment. We will be the two presenters. But we're only 2 team members on our team of lots and lots of staff. So we'll speak to our experiences, but there's lots of other important contributors to the team and to the conversation about inclusive education and MTSS as a whole. But I will get started. So our presentation today is on inclusive education through the multi-tiered systems of support. And my name is Christina Ferguson. I'm a school psychologist with the Cape Breton Victoria Regional Center for Education.
And I'm Alice Stevens. I'm a speech and language pathologist with the CBVRCE, and this is only my second year working, although I've been in SLP for 11 years now. I come from the world of private services. This is my second year working with the school with the Center for Education. So this is all learning as I go as well. And I've been excited to be working with the MTSS model for a little bit now, and excited to continue to learn more as we go. So Christina?
Perfect. So just before we start, I'll give a little bit of a background on inclusive education and what it means. So inclusive education means to provide safe and caring schools, to provide teaching and supporting all students using evidence-based approaches and supports. It means to promote students' physical, social, emotional, and behavioral well-being and achievement. And inclusive education means allowing every student to have access to equitable and high quality education that is culturally and linguistically responsive, accepting, and respectful. Okay, so we have our family of schools model here in CBVRCE, and this is our student services model. This is how we provide supports to our students. So here in Cape Breton, we have 4 family of schools, and each family has many schools within it. So elementary, middle school, and high schools. And each family has 1 lead or 1 support person for the family. And the leads meet regularly with the coordinator of student services. So this is a newer model of support for our area. We're just in the first few years here of using this, and it is specific to CBVRCE. So that means it's not necessarily consistent, and we don't believe it's consistent across the regional centers. But we are really enjoying using this team approach here because in the past, it was a little bit more like we were working as individuals, individual professionals in our own little silos. But this is a team approach. So it allows for information sharing and collaboration. It allows for collaboration within our team and across our family of school teams. And it means that we are collectively responsible for the students' well-being and their care and their support. So it's more flexible to respond to our student needs and to our school needs. And we're very aware of other supports that the students are receiving and the other specialists or service providers who are supporting our students. So I will just give you a little bit of a background, who is on our family of schools teams. So we have our student services coordinator and our student services consultant. There's also a family of schools lead or the support person, and sometimes this is the same person as the consultant, but not always. We also have speech language pathologists on our teams, school psychologists, autism specialist teachers, behavior support teachers, schools plus facilitators and outreach workers, school social workers, program planning specialists, assistive technology specialists, and child and youth care practitioners. And then you'll see on the right side of the screen, we also have our school team composition. So our school teams, depending on the student and their needs, are made up of school administrators, so the principal and or the vice principal, classroom teachers, the learning support teachers, and if there are any speech language pathologists or school psychologists servicing the student, as well as any school partners, whether they be from Schools Plus, social workers, the school health partnership nurse, the occupational therapist or the physiotherapist, APSE, or anyone else that we may be forgetting about in this moment. So there are lots and lots of staff who are on the school teams, which means that there's lots of people supporting the student, and it's a really comprehensive approach to student support.
So in terms of what is the multi-tiered system of supports, MTSS is an integrated school-wide approach which provides a structure for effective instruction, assessment, and support for all learners with a focus on well-being and student achievement. Successful implementation of MTSS requires the collaboration and coordinated efforts of learners, teachers, families and guardians, parents, and community partners in providing the appropriate programs, settings, supports, and services that our students need. This is a system that is flexible and able to respond to students' needs, including time out of the main classroom if and only if that is what's required to assist the student and provide true equity. So you'll hear us talk about equity a lot, or equitable distribution of services a lot throughout this presentation. Keep in mind that equitable is different from equal. When all students are receiving equal supports, they're receiving the same supports, versus equitable supports are more responsive to student needs. It's also important to recognize that a student can be receiving support at different levels or different tiers at the same time. So a student may be covered by a tier 1 program running in the classroom. At the same time, their needs have been identified as elevating beyond that level, of needing support beyond that level, and so may be included in a small group program or have individual support provided for the same issue that is being targeted at the classroom level. Next slide. So, in tier 1 or universal and classroom supports can be provided directly or indirectly. So directly to the student would be things like me as an SLP coming in and teaching a whole class lesson about how to produce the S sound or the S sound correctly, or a language lesson about responding to WH questions. Or it could be indirect, such as me attending school and teaching support team meetings. Other types of services that would be considered a tier 1 support would be co-teaching, performing classroom observations. So you're observing how the student's functioning and being able to identify what the challenges or barriers are for them to succeed in the classroom, as well providing support with physical and visual structure of the classroom environments, including seating arrangements as necessary and other types of things that, again, provide an elevated opportunity for students to succeed in the classroom. We also can provide professional development for the teachers and TAs. This would be an indirect tier 1 support, and we have been seeing more and more of this, especially in some sort of specialized areas where TAs are supporting students with specialized needs, and so the TAs are being trained by specialists in the field to be able to provide support for that, as well coaching and modeling for teachers and TAs. And as our RCE has adapted to providing summer services, I would add parents and families to that list of who we're coaching and modeling as well. We're having opportunities in the summer for parent programming as well. Next slide. One thing to mention about having Tier 1 as a level of intervention is that it means we don't have students lingering on wait lists for a long time, because we do have, although there might be a wait list for elevated level of support, such as a Tier 2 or a Tier 3, the student is receiving Tier 1 universal support at the classroom level. Tier 2 does not, another thing about Tier 1 is that it doesn't require a referral or parental consent. So when those needs are identified, we can jump right in with the support the student needs, rather than waiting for the paperwork to kind of catch up with what we recognize the needs for. Tier 2 would be direct service provision to a small group of students. In order to receive Tier 2 support, you would need a referral from the class and consent from the parents or families. This Tier 2 interventions could occur in the classroom or as a pull-out session. It is, as with all of these, evidence-informed interventions are a big focus. We want to support with specific learning targets. Tier 2 requires an increased coordination and collaboration among classroom teachers, support staff, specialists, regional board staff, as well as students and families. And a real positive of Tier 2 and Tier 1 both are building capacity and seeing the collective responsibility that we share for our students' well-being, and sharing information so that the others in the circle of support are able to provide the support the student requires. One example of this targeted or small group Tier 2 programming is called the Program for the Education and Enrichment of Relational Skills. Here we just call it PEERS, and that's a program out of, I believe, UCLA that we've been using for our students in middle school who have been diagnosed with autism or other social relation challenges, who are able to come together as a group with facilitators that could be an SLP, a psychologist, or a school staff, to work on building those individual skills that will make a difference for the students' well-being and long-term outcomes. Another example of a Tier 2 or a targeted small group program would be grouping some of the articulation, some of the students who need assistance with articulation or for language intervention, to provide home practice materials, parent consultations, and informal assessments and observations. Again, as I said before, classroom observations can be a Tier 1 and can also be a Tier 2. We can observe in the classroom to determine what other supports our students might need for success. And in Tier 3, we get to what really is the traditional therapies that we're used to seeing. So the pull-out model, where you are going to the door, knocking on the door, calling for Johnny, and taking him down the hallway to the little individual workroom and doing a speech or language therapy session. Again, as always, it's evidence-based, but this is more intensive and extremely individualized interventions. A speech language assessment would also fall under Tier 3. Supports are flexible and responsive to the individual student needs. Long-term interventions are based on student strengths and challenges. As well, in this level, there is collaboration and cooperation among teachers, administration, learning support teachers, school-based and regional specialists, families, and intra-agency programs and supports. But at this level, there is less of that as more direct one-on-one. Just because the child is receiving Tier 3 support doesn't mean there'll be that level of support forever. The idea is to provide the intervention that's necessary, collect the data to demonstrate that they are making progress, and then they might once we get through a period of intensive intervention, might kind of slide down to a level 2, so working in a small group, or even back to level 1, where the intervention for this particular skill development is back to the classroom-based level. I hope that makes sense.
Okay, so Alice kind of explained the multi-tiered systems of supports model, and then she in-depthly explained each tier. So what tier 1 means, what tier 2 means, and what tier 3 means. So now I will kind of just sum it all up and give a little bit of an overview on the MTSS model. So here in Cape Breton, it's really hard to talk about MTSS without discussing our student services model, which is our family of schools model, because this model of support with MTSS is effective with team communication, consultation, and collaboration. So as Alice mentioned, it allows us to build capacity within our schools, and it allows for direct and indirect services. So as mentioned, a direct service would be something that's face-to-face with a student, whereas an indirect service is something that's not face-to-face. So that might be more of a consultative basis through attending a teaching support team meeting or a student support team meeting. The MTSS model has impacted our current roles by allowing for significantly more collaboration. So as I mentioned, the collaboration happens through our team meetings. It may happen through skill building groups when we're able to collaborate with other specialists and provide these groups together. It may be through professional development where we're able to provide that PD and those opportunities to teaching staff or others. And our family of schools student services team model meets monthly. So this allows for consistent and ongoing communication. And it also allows for information sharing about our roles and any current or upcoming projects that we have on the go. So there's always a learning opportunity for us as well to learn about each other's roles in the schools. MTSS allows us to constantly evaluate and reevaluate our services and to determine where we can collaborate or improve. It also allows our schools to focus on the different ways that their students are being supported. So support through MTSS follows the tiers. So first we would focus on tier 1 at the classroom level. And then we would move to tier 2 if that's necessary, where it's a more small group model. That could be in class support or it could be pull-out support, depending on the student's needs. And then, if necessary, we would move on to tier 3 support, which is a more individualized support. So support always follows the tiers, and the support and following those tiers and determining what level of support is necessary, we determine that by collecting data. So that determines what level of support is appropriate. And we can help to collect that data, and then we can help to interpret the data and determine what the next steps are in terms of intervention or the model of support. Having the MTSS model also prevents double dipping in terms of supports or having more than one person providing a similar service. So what that means is if there's multiple specialists providing a similar skill-based group or skill targeting group, then that allows us to kind of reevaluate what support is best and how can we come together to provide that group and provide the best support to those students. And with this, it also allows for more efficiency and better time management. So I would say that our schools benefit from the MTSS model, our students benefit from the MTSS model, and we also benefit from the MTSS model. I'll also mention that in some aspects, the tiers of support, so most often tier 1, can vary greatly between our schools. The tiers of support for each specialist often depend on the needs of the school, and as we know, they can vary greatly from school to school. So the specialist may learn the needs of the school through experience by servicing that school, or they may get input from the school team or the administrators at the school. So what I mean by that is admin may share their goals for the schools for each year. They may ask their specialists for input, and they may ask for support in determining how to make sure that support aligns with the MTSS model. So now I will speak about school psychology across the tiers, specifically and what that support looks like in Tier 1, Tier 2, and Tier 3. So Tier 1 for psychology support, we're always focused on building capacity within our schools through consultation and modeling. So when I say modeling, that may be with the school team or with the teachers in the classrooms or the teacher assistants or any other staff who are providing support to that school, and showing kind of hands-on exactly what that support should look like, and when that support should be implemented. So as school psychologists, we participate and collaborate with our teaching support teams and our student support teams. And sometimes we refer to them just as TSTs or SSTs. And this is done through reviewing and endorsing referrals for services, through supporting our learning support teachers, through the development of individual program plans or IPPs, and through the development of classroom adaptations, through class-wide behavior supports, and school-based decision-making regarding appropriate placement of students. So if they're looking for a placement for a student in a particular class. We also support the implementation of evidence-based interventions through teacher consultation and gathering data. So this may be done, like I said, through data collection and evaluation. So that may be pre and post testing. Then we help to interpret the data, and then we help to determine the next steps for support. We also support school-wide staff, or we can do this through professional development. So this may be through best practices, inclusive education, through social emotional learning. It may be sharing information about instructions for students with disabilities, information about diversity, trauma, literacy initiatives, anything like that. And we also provide the implementation of calm spaces and microenvironments in the classrooms and transitional supports for primary students. So you'll see that this support is Tier 1 because it's not specific to one student. It's done through a consultative approach. It's done within the classroom with all of the students. Okay, so that we have Tier 1. Now we'll move on to Tier 2, and school psychology in Tier 2 typically looks like skill building groups, whether that be focusing on study skills, strategies for stress management, anxiety, worry, grief, self-regulation, social skills, the peer programming, as Alice mentioned, and learning strategies. And those are just some examples. We also support through consultation and collaboration with learning support teachers. And this is done as requested. So it could be in the form of small group practices like the zones of regulation or social emotional skills. And we keep in mind that it is always evidence-based. Tier 3 support for school psychology is typically, it may include psychoeducational assessments. It may include psychoeducation sessions. So this is really educating students about different disabilities, whether it be learning disabilities or ADHD, or different factors that are coming into play and may be affecting their learning. It's also done through reviewing past psychoeducational assessments, supporting our student support teams in implementing recommendations for learning, and making any other recommendations that may be appropriate for home and for school. We also endorse our own referrals. We provide transitional support for students with learning needs, and this could be done from grade to grade or from school to school, and even as students transition to post-secondary after high school. We also provide behavior consultation, observation, and programming support. And this is often done through consultation with our behavior support teachers and sometimes our autism support teachers as well. We offer skill building and coping strategies, which would be an individualized one-on-one support for anything like learning challenges, stress, emotion regulation, grief, growth mindset. We provide mental health support and referrals to outside agencies as necessary. And we also collaborate with outside agencies and parents and families. So we really provide any support that is going to be helpful for the student and their families, because we support students in advocating for their child, because the parent is an essential part of the school team. And I'm just thinking, I don't think we had parents on our slide earlier when we talked about team members, but they're always an important part of the school team. They know their child best, and oftentimes they'll know what supports they've tried in the past, what has worked and what hasn't worked. And so we always like them to be a member of the school team when possible as well. And we also collaborate with external agencies to support the overall well-being of our students, whether that be family supports, the parent navigator through our school system here, mental health supports, justice, social work, Schools Plus, pediatricians, family physicians, community services. So as you'll see, there's lots of collaboration with supports that are in the school, but also outside agencies as well. So I also want to mention that you'll notice that some of the supports are consistent across the tiers. So they may show up in tier 1, tier 2, and tier 3. So for example, skill building is something that can be done as a whole class support, as a small group support, and also as an individualized support. So I just wanted to mention that as well. And since we're in the summer, a lot of our summer services focus on tier 2 and tier 3, seeing as the classes aren't in session right now. And so a lot of our support through the summer is done through skill building groups and is done through assessment.
So I'll kind of reflect on what Christina has said from the perspective of the speech language pathologist services. At tier 1, as I'd mentioned before, this can be either direct or indirect service provision, meaning it's directly providing services to the student or to those around who are supporting the student. This would be attending teacher support team meetings or student support team meetings. This could be class-wide articulation or language lessons, as I mentioned earlier. As well, we have a primary screening program where all of our students are screened as they enter school. So we're identifying early identification of speech and language issues is very important for providing appropriate intervention. We look at training and providing training and supporting to TAs and teachers in supporting especially complex communicators like AAC users, the students who use augmentative and alternative communication systems to communicate, and as well as mentioned numerous times, classroom observations. And my very favorite of the tier 1s is co-teaching. Part of why this is so satisfying is because it is a chance to build my own professional skills. I'm much more comfortable in the classroom, at the front of the classroom now than I ever imagined I would be. And part of that development of my own professional skills has been because I have been paired with so many strong classroom teachers and have the opportunity to learn through them. Vice versa, they have learned to become better SLPs to their students in their classroom with speech, with articulation and language issues because of me working closely with them. So the professional learning that goes on at the tier 1 level cannot be understated. It is a very, very satisfying part of our profession. Tier 2 is direct service provision. It can happen in the classroom or out of the classroom, as I had mentioned. So these would be group-based interventions for articulation and language. Occasionally, there's the opportunity to group students with disfluency concerns. This happens less often because they're less common. Some group-based interventions can occur during in the high needs learning centers, where we have numerous students with similar diagnoses or who present with similar skills, and working in the group level in the classroom to work at building those skills. Social learning groups run in conjunction with other student services and school-based team members, like the peers program that's been mentioned a couple times now. As well, we can provide classroom-based group support, and that might mean that we come in during a time when a teacher is running centers for their students, and I'd be able to set up a center. So I'm working with the students on a related topic to what the class is doing, but at a deeper level. So I'm providing opportunities for these students who need a little more additional support or more explicit teaching or alternate learning strategies to learn some of these speech and language skills. And at the tier 3 level, again, this is what you think of when you think of traditional SLP services. It is pull out, mainly direct intervention, and includes our assessment for articulation or speech production concerns, receptive and expressive language concerns, disfluency, stuttering, voice concerns, and we've had a lot of opportunity recently to work on an issue called selective mutism, where there's a lot of collaboration between SLP services and psychology services. The individual therapy or intervention, so again, traditional therapy, augmentative and alternative communication, device selection and programming, as well as teaching the parents how to support device use and parent training. Parent training is key for AAC users, is also key for any carryover for individual speech sessions. As well, occasionally we are collaborating or providing referrals to outside agencies, such as appropriate, such as for some of our students who have had cleft palate repair. We are working in conjunction with IWK services and Nova Scotia Hearing and Speech Services. Many of our students with the diagnosis of ASD come in having worked closely with the EIBI program in the province, and we have a role to play in bringing those skills into the classroom and into individual therapy sessions as well. So when you look at, next slide. So in conclusion, what we would say is that MTSS, multi-tiered system of support, is a dynamic and multifaceted approach to student support that provides opportunities for personal and professional development of staff, as well as supporting the learning and well-being of students. Focuses on equitable service delivery, meeting the range of student needs within the classroom and providing supports beyond the classroom as appropriate and necessary. I want to thank you all for joining us today for this short presentation on MTSS, and I welcome any questions that you have at this time.
I have kind of just like an operation question, because I'm just curious. So per like the amount of students that Cape Breton, like the whole center has, like how many SLPs and school psychs do you have?
We're just expanded our team in a couple of directions. For one, we have now 2 specialist SLP positions, which are newly created this year. One of them is an early autism communication specialist who works with students in primary and grade 1 who have a diagnosis of autism. We also have an AAC specialist, and that is a new role this past year as well. We have 10 circuit SLPs and just got another added to that. So me as an SLP working here in the CBVRCE, I have 3 schools. I'm responsible for one large elementary school, one smaller elementary school, and one middle school. Every circuit clinician's circuit is slightly different, but we try and make sure that we have approximately the same number of students that we're providing service to. The challenge with that is that we know that kind of the needs can vary, not based on the numbers, but on the makeup of the student population. And so we're really working to try and figure out a better way to and having the specialists available to step in for those complex cases or those higher need situations is one way of addressing this. But we all know funding
Yeah.
is really where it's at, right? I don't know if that answered my question, your question from the SLP perspective, Christina.
It did.
Yeah, I can answer for psychology. So we have 12 school psychologists here in CBVRCE, and we have one lead psychologist, and we all have our own circuit of schools. So we service, I don't want to give a number because it changes depending on the circuit and depending on the populations. But we do all have a circuit of schools. And we typically meet once every, it depends, maybe 2 months or every couple of weeks, depending on what's going on. So there's lots of collaboration within our team. And this year we are also going to try out a flex position. So we will have one psychologist who won't have their own circuit, and instead they will assist in the circuits when necessary. And that can be support through tier 2 or tier 3.
Cool.
Yeah.
Thanks for the question.
Just a comment, if I may. And
Sure, of course.
so, thank you so much, both of you. This is just a personal comment. It's not about from everybody else, but I really appreciated a couple of things that you both did for us, and that was to explicitly connect your work with classroom teachers at Tier 1, and how, Alice, you said it really made such a difference for you for your own professional learning to be in the classroom coming from private practice, because I know that, I've worked with lots of SLPs, that's a big shift to come and work in the school system. And so I know how valuable that is. And,
and can I say that working under a model of MTSS, that transition has been much more of an expansion of my own skills, as I had kind of said, that I'm suddenly able to do things I never imagined as an SLP, standing up and teaching, teaching a class. But because I'm well supported in a family of schools with connections and collaboration, it really has provided me opportunities that I didn't know would be within my skill set. So really, really good chances to grow.
That's wonderful. That really is. And I know it's hard to identify numbers for both of you, both Christine and Alison, around, how many more children are you able to see or how much more of an impact can you have. But there's no doubt when you're able to help classroom teachers and acquire some of those high leverage or evidence research-based practices that they can use within the context of the classroom setting, it certainly makes a difference for the teachers and their confidence and for the children. So.
And
For
can
sure.
I say as well that it's being able to have that connection and collaboration makes it feel like more of a community approach, and rather than work in the silo that you're responsible for it all. It's like, no, we have to work together to see the outcomes that we want. So to have that closeness is a different level of satisfaction than you ever would get working independently.
And one of the notes I put down here was that, you mentioned that the children, the types of interventions and supports can vary. So in other words, they were looking at Tier 1. They may need some Tier 2 or possibly Tier 3, more intensive, but it doesn't mean they're there forever. It doesn't mean they necessarily need, near Tier 3 all the time. In fact, if it's working effectively, then hopefully we can,
exactly,
move back, and especially with speech right? And
Yeah, and
they still at
especially like
first.
whereas previously, like, and I wasn't in the school system, we're like living it, but I heard lots about just wait lists and wait lists. And being able to
Very true.
intervene at the tier 1 level, teach
Mhm.
the teachers the skills
Yes.
that are really going to benefit these students. Then
Yes.
I clear my wait list. I'm able to kind of work on those trickier situations or those more
Yes.
complex cases
Yes.
and give my time and attention where it will make the biggest impact.
That's great. And the services do certainly vary from region to
Oh,
region.
yes.
So we're constantly talking to other psychs in other areas to find out what are they doing, what's working, what's not working,
Yeah.
and trying to adapt some of that into our practice as well. So I'm not sure what regions you folks are from, but your psychs and SLPs may provide different services there, or their model of support may look different. And it may be because that's what's working best in your regions.
That's a really good point.
I'm not a classroom teacher. I'm not a classroom teacher, but it's kind of interesting to see how you guys manage. It's the communication piece that I find is important. So like kind of what I'm taking away from this, because I'm a principal of a school. So it kind of helps me wrap my head around how can I better create that collective efficacy between the board and my teachers.
Yeah.
Absolutely. The communication piece, like you said, is the biggest, most important piece. Especially when you're looking for a service. If you don't communicate that, then we have no way of knowing that that's something that you feel like your school needs. So I typically will consult with my administrators, several times throughout the year to find out, this is what I'm doing. I think it's working. What do you see? Is there anything else that you'd like to have, what work would you like to have done in your school? And just having that ongoing communication is really what helps the services evolve.
Yeah, for sure.
And the flexibility to not be so stuck in the rut or say, well, this is what I do, this is what I've always done, but to be able to kind of imagine that, oh, we can target these things in a different way that can improve our efficacy.
Yes.
and spread ourselves more thin without watering down the services that we're providing.